A Buffalo church is working to uplift the community around it through an educational breakfast and health fair happening 1 week from tomorrow.
Reverend Michael Bell is with Durham Memorial AME Zion Church. He is here along with Garnell Whitfield and Mark Dobson. Gentlemen, thank you so much for joining us on this Friday.
Thank you.
Thank you.
Anytime we get a chance to talk about mental health or health care, we are obviously going to do it. These are very important topics. We're talking about health care. We're talking about getting a community healthier. Talk about the foundation of this event while we're doing it.
Well, you know, it's a very interesting thing. I think what we want is want better for the Buffalo community. We want Buffalo to shine, and part of it is helping the community to be better, to live better, and ultimately that makes a better neighbor.
And looking at this event, you know, it's information, it's resources, it's screenings, all in one spot, right? Garnell, you had posted, you said this event has the power to transform lives.
Absolutely.
Speak a little bit on that.
Yeah, what's so exciting for me about this is the collaboration. Not just, you know, it's not just the church, but it's persons within the community, throughout the community, different entities coming together on behalf of the community.
Can I also offer one more thing? It just occurred to me. These are three men up here talking about the importance of health and health care. And that is the stereotype, right? That men don't seek care, that oftentimes it's the women in our lives that are pushing us to seek care. Here you have three male leaders of this community who are saying, healthcare is important, and you got to take ownership of it. What do you guys think that says? That's an important part of this, too.
No, that's a very important part, because so often people have certain stigmas when it comes time for them to investigate ways of managing their health. When you tell someone, you know, maybe at your age you should have a prostate exam or a colonoscopy, they may not know exactly how to approach that because they're looking at it through a stereotypical lens. Here, by disseminating information, by putting them in contact with individuals, professionals that can show them where the resources are, kind of being like a social version of a patient navigator program. They're going to be better able to take care of themselves, take care of their families, and really that's what it's all about, especially when you're dealing with a disparaging community.
And when you're talking about collaboration, you have over 40 different vendors. Talk a little bit about who will be joining.
Well, we've got Roswell Park. I've got to give thanks to Bernarda Arias and Nakia Clark, because they are bringing their Edibus, which is going to be doing lung detection for people that smoke. You know, we've got Univera, we've got ECMC, we've got the Department of Health and Human Services that are coming out, in the Department of the Aging. We've got over 50 vendors that are coming, so we're excited about that.
Including the University of Buffalo, the dental school,
Absolutely.
School of Social Work. So when we talk about health, we're talking about wellness, we're talking about those factors that go beyond pathology, but most important, and I think Brother Mark had talked about it, is that equity is really about ownership. And thank you for opening up that door.
Yeah, absolutely. And also, this is all starting the conversation, because so many of it kind of normalizing those. I'm so glad you talked about colonoscopies and prostate exams and things like that. It is it's part of normalizing that normalizing those procedures, those medical procedures that are available, and that could save people's lives. And that starts with just having a conversation. So it sounds like you're just kind of inviting the community to have these conversations, and they can have lots of different conversations with lots of different agencies.
Absolutely. Matter of fact, speaking of agencies, one of the organizations that's supporting this is the Masonic community. We have the Prince Hall Medical Mission, which has been phenomenal in trying to help people in black and brown communities understand how to better navigate their health. They're a part of this, and locally we have Masonic lodges, Paramount Lodge number 73 and our Eastern Stars, that are supporting this initiative along with the church and this dynamic pastor and Garnell. So we're very excited about this. This is something that adds to the church's legend, because I remember years ago when COVID first hit, Dr. Raul Vasquez vaccinated over 1,500 people in short order out of their community center. So this continues the legend, the great legend of Durham AME Zion Church in Western New York.
Wonderful. Very quickly, before we let you go, let's run through all the nuts and bolts. When it's happening, where it's happening, and if they need to prepare anything before they come ahead of time.
Sure. October 25th from 9 to 2. You know, be there, you know, in the number. We're going to have a wonderful time in our community. None of this works without the community. So we need people to come out and to participate. This is our first event. We hope it to be an annual event, and so we're very excited about it.
And when you come, expect at 9 o'clock, we'll have a breakfast, a dynamic breakfast.
Dynamic breakfast.
Not just eggs, dynamic eggs.
And then we will move on into the workshops and so forth.
Yeah.
And I certainly look forward to it, being a native of Buffalo. So thank you.
And thank you for giving us this opportunity to share this
Thank
with
you.
our friends and citizens in Western New York.
Appreciate your leadership on this, guys. Thank you.
Yeah,
Thank you.
Thank you.
Thank you all.
And if you at home missed any of this, you'll be able to find this entire interview with all the information up on our website, WIVB.com.